Well, a new UK study suggests COVID-19 patients face a much higher risk of developing blood clots than those vaccinated with AstraZeneca or Pfizer shots. The study finds that for every 10 million people who receive the first dose of AstraZeneca, about 66 will suffer from a blood clotting syndrome. That compares to more than 12,000 more incidences recorded in 10 million people who have tested positive for COVID-19. And joining us now is Dr. Jeff Weiss. He's the executive director of the Thrombosis Research Institute at McMaster University. Thank you so much for joining us this morning.
Thank you for having me.
All right, so can you help us better understand this study and put it in perspective for us?
Yes, I mean, this study focused mainly on the AstraZeneca vaccine, which is the vaccine that's not being used right now in Canada. I think people are going to be more interested in the data that are coming out with the Pfizer vaccine. And once again, these data indicate that the risk of blood clots is much higher with COVID-19 infection than it is with a vaccination. So the study showed that in people getting the Pfizer vaccine, with 1 million individuals vaccinated, there were 14 cases of hospitalization with stroke, compared with in 1 million people who tested positive with COVID-19, there were 12 times as many, 169 per million cases of stroke. And we don't even know whether the stroke that was associated with the Pfizer vaccine is cause and effect or just an association. We also know that in people with COVID-19, clots in the veins occur almost 100 times more frequently in 1 million people receiving or in 1 million people testing positive for COVID-19. We'd expect to see about 1,250 vein clots. So clotting problems are much more common with COVID-19 infection than they are with vaccination with either the Pfizer vaccine, the AstraZeneca, or the AstraZeneca vaccine. And really, I think this information should just inform individuals that they need to get vaccinated.
Yeah, and Dr. Weiss, I was just going to ask you, if anyone watching is vaccine hesitant, put in perspective how this risk compares to not being vaccinated.
Yeah, I mean, to not being vaccinated, your risk of getting a blood clot is at least 10 to 100 times higher. Plus, we know with the information you just announced that in the cases, new cases of COVID-19 infection in Ontario today, 80% are in people who aren't being vaccinated. Most of these cases are with the Delta variant, and we know that the outcome of patients with the Delta variant is worse than with the original COVID-19 infection. So it's very scary, particularly as we have kids returning to school in the new year. We have people who, you know, those under 12 who aren't vaccinated. We need everyone, all adults, to get vaccinated so we can protect our more vulnerable individuals, including our children.
All right. Well, thank you so much for all of that information. Once again, that is Dr. Jeff Weiss. Thanks again.
Thank you.